Welcome to Adapting Place, and thank you for deciding to watch this video. This is one of the most missed questions on my Q bank. 10 questions I yield facts. I'm going to give you some of the key facts, the reason why people missing these questions. If you see it again, don't mix it. So this is the question. It's a 10 question. Go read from the back, select or that apply. Which behavior should the nurse expect? That is the keyword. A nurse is obtaining history from a parent of a 5-year-old child diagnosed with what? Attention deficit hyperactive disorder. Which behavior should the nurse expect? Take your time, find the buzzwords, rewrite the question you're on, select or apply. Don't pick everything if you don't understand it. Pick those you're confident. So that if there's one answer, you pick it. That's all. He said expectation for ADHD. What do you expect from an ADHD patient? The answer is here. Attention deficit hyperactive disorder. I've given you the answer. Therefore, what do you think? Difficulty maintaining attention. That's the answer choice. Attention deficit. Excessive talking and interrupting others. Hyperactive. Right there. Preference for a quiet and solitary activity. How? If you disturbing other people, you will not like that. Impulsivity and difficulty waiting turns. This is it. Attention deficit hyperactive disorder. Consistent ability to follow detailed instruction. Hyperactivity cannot happen this way. Therefore, what is the right answer? As you can see, difficulty maintaining attention, excessive talking, doesn't like to be alone, impulsiveness, and difficulty waiting turn. That is why does not follow command. This is how you answer questions. Which instruction should the nurse include? Select or apply. A nurse is educating a patient about the partial gastrectomy to prevent long-term complication. Sometimes you see questions like that, it's all content. Every time you see partial gastrectomy in your NCLEX, change this to what? Damping syndrome. Every time they give you partial gastrectomy or any gastrectomy, BROF 1, BROF 2, they asking you about damping syndrome. How do you prevent damping syndrome? Slow things down and lay flat. Therefore, how do you do that? Eat small, frequent meal at a time and drink between your meal, right? Between, not with your meal. Simple sugar will increase damping. So you want to have complex carbohydrate. Lay down after eating. You may need vitamin B12 because of the removal of your stomach and increased protein intake. That's why people who have bypass, we give them protein shake. Which teaching should be included in the care plan of a breastfed newborn to prevent hyperbilirubinemia? Bilirubinemia, how do you get rid of bilirubin? Through feces. Therefore, what do you think? The kid has to poop. How does the kid poop? Feed them. When you feed a kid, it's going to poop. Therefore, encouraging feeding. Delay feeding is going to cause a problem. Use a supplement does not prevent you from pooping. Limit sun exposure is bad. Sun exposure will help with it. That's why we do photosensitivity, phototherapy regarding this problem. Therefore, encourage feeding. Which diet instruction by the nurse is appropriate? Select or apply. A nurse is providing teaching to several middle-aged female clients on osteoporosis. You see the way I read the question? I start from the back. I know it's select or apply. I don't have to pick everything if I don't know. And I'm going to go for the buzzword. The case is a diet instruction to do what? To prevent osteoporosis. That means I should pick something that has calcium or vitamin D. This is a teaching for you. So I give you all this. It's a mixture of vitamin D and calcium. So all of them are right answer. If you don't know them, memorize them. And you can see the answer choice I gave you. Calcium, almonds and grain. Almonds and grains are calcium source. Vitamin D, you have egg and yolk. And then both vitamin D and calcium are salmon, milk, yogurt, and sardine. Those they contain a bunch of vitamin D and calcium. Which action should the nurse take first? The nurse is caring for a client with what? NG tube for a small bowel obstruction. Yes, NG tube for small bowel obstruction. The nurse noticed that the tube is clogged. Unclog it. How do you do that? Don't put any chemical in it. Use natural means. Flush it or put air in it to ensure that it's working. Giving iron suction will not unclog it. Remove and replace it is not necessary. Use Coke and soft drink is not necessary. It's not part of the NCLEX requirement. Inject air into the blue tube will help with that. Which diet teaching the nurse should provide at discharge? Same thing, teaching. At discharge, a nurse is caring for a client diagnosed with what? Kidney stone due to what? Calcium oxalate. Test-taking strategy. Why do I say kidney stone made up of what? Calcium oxalate. That means the individual should avoid anything that contains calcium oxalate. What are those? If you don't know it, they are rhubarb, spinach, wheat bread, and peanuts. Higher source of oxalate. So the client should avoid them. What should the nurse do next? A client in the PACU after partial gastrectomy with cut the stomach bypass with the NG tube in place. There's a reason why, to decompress the stomach. The nurse noticed there is no drainage in the NG tube for 30 minutes. That means it's not working, it's clogged. You got to check patency or you got to unclog it. Reposition the tube to encourage drainage may be a possible way. Instill air and clamp the tube for few minutes. Air is good, but not to clamp it. Irrigate the NG tube with saline to check for patency. You want to check if it's working. Notify the healthcare provider immediately. You can do something. So irrigate it. Which instructions should be included in the teaching? Once again, teaching, risk management, As you can see, all the questions are risk reduction, right? And nurse is educating a client who is scheduled for what? Electroconvulsive therapy. What instruction should you include? You have to know the keyword. The buzzword electroconvulsive therapy is used for refractory depression. What do? We create seizures. We create seizures to treat what? The depression. Therefore, these individuals need to be monitored. They will have memory loss short term. They may need sedation, right? So you may experience short-term memory loss. You need to fast because we don't want you to aspirate because we create incision in you. You may be awake during the procedure and aware of the treatment. ECT is primarily to treat what? Severe depression. You may be given muscle relaxant to help with that. You will not have pain. You will not have pain. Then I'll go back here and say, you'll be awake during the procedure and aware of the treatment? No, because I'm giving you sedation. You see how they can trap you? So this is not right. It's a test-taking strategy. You can think about it. If I'm creating seizures and I'm giving you sedation, why will you be awake? I intentionally selected to see how the NCLEX, you try to select, and you're in the row, you say, it does not make sense. If I have to give you sedation, you're not going to be awake. And this is assessing a patient who may have obstructive sleep apnea. Which findings should the nurse expect to find? Select or apply. What is consistent with sleep apnea? Go to the buzzword. Obstruction. They have to be obstruction. Sleep. Your sleep is disturbed. Apnea. You stop breathing. You see what I've done? I've given you the answer based on the name. Therefore, snoring. If you don't sleep during the daytime, you're going to sleep. You're going to have headache because you don't sleep. There is no swallowing issue. You're going to wake up choking. Which instructions should the nurse include? Select or apply. A nurse is teaching the parent how to use incentive spirometer. What do you do to expand your lung? What do? You take in air. What do? You hold it. What do? You don't push it out. You just basically suck in. So before that, you exercise. You exhale completely so that you empty your lung, right? Then you inhale slowly, deeply, so that you can take in the air to open your lung. You hold your breath. You can't lay down. You have to remain upright and perform the exercise 10 times an hour. This is Adapting Class. Thank you for watching. Good luck as usual. Bye.